Hello everyone. In the last lectures we have covered about the respiratory tract. In today's class we are going to discuss a disease of the respiratory system, that is sinusitis. Now why are we focusing on sinusitis? It is because it is one of the most common type of disease that occur especially in children and adolescents. Now what is sinus, right? These are the air-filled cavity in our skull. From the picture we can see that there are different types of sinuses: the frontal sinus, the sphenoid sinus, the ethmoid sinus, and the maxillary sinus. What are the work of sinuses? These help in making the skull a bit lighter and also in voice resonance. Now, what is sinusitis? Whenever we see this word itis, it means that there must be some kind of inflammation. Now, in case of sinusitis, the mucous lining of the sinus cavity gets inflamed or infected. Now, there can be different reasons why sinusitis may occur. It can be viral infection, bacterial infection, allergen, or anatomical reasons. In case of viral infection, fever can firstly common cold can occur, and then that can lead to inflammation. In case of bacterial infection, after the viral infection has occurred, the secondary infection occurs by bacteria. That is the bacterial infection, and like Streptococcus pneumonia, Haemophilus influenza can be the reason of these bacterial infection. And then due to different kind of allergens, inflammation can occur. And in case of anatomical reasons, the deviated nasal deviation or the nasal polyp can lead to inflammation. Now, what happens if, what is the pathophysiology of the sinusitis, right? Well, whenever the inflammation occurs, the lining of the mucous line increases, right? And this leads to the blockade of the sinus cavity, and the mucus accumulates, and as a result it creates a perfect environment for the bacterial proliferation. Now, what are the symptoms of sinusitis? If sinusitis occurs, facial pain and pressure can happen, headache, and then sense of smell can decrease, then nasal congestion can occur, and then there is fever. Okay, what will happen after that? When sinusitis occur, what are the treatment systems, right? For the treatments, for symptomatic relief, analgesics can be prescribed, or nasal decongestion can be prescribed, or saline nasal drainage can be prescribed. In case of bacterial infection, antibiotics can be prescribed. And for this identification of the disease, the symptoms will be firstly examined, like what kind of symptoms happened, or in case of severe cases, CT scan can be done. Now, after that, what do we have to do to prevent sinusitis, right? To prevent sinusitis, we have to be more hygienic. We have to manage our allergens. If we have any kind of allergy, we have to manage the allergies. That is it for today.